Let's talk about some of the things we treat at our clinic. As you know, we have massage therapy on staff as well as chiropractic care. Another thing that's unique about our clinic is we do bioidentical hormone testing. So we do saliva testing. The lab that we use is a professional lab out of Oregon called Labrix, and we can do saliva tests which will give us values on your current hormone values. And that, to me, is far more accurate and pertinent information than blood hormone values. We found that in the saliva actually tells you how much of a specific hormone is available to be used in your body rather than just the amount that's bound to the blood molecules. We treat a lot of temporomandibular joint dysfunction. I receive multiple dental referrals a month for temporomandibular joint pain, and what we found in the past few years is that there's huge correlation between cervical spinal dysfunction and temporomandibular joint dysfunction. We also know that the actual temporomandibular joint is a fairly dynamic joint, and so not only can we have cervical spine problems that initiate or can compound the jaw pain and problems, but the actual temporomandibular joint can be balanced and equilibrated using chiropractic manipulation therapies as well. Naturally, we treat a lot of low back, thoracic, and cervical pain. So just your average, I need to be tuned up or fixed, that can be taken care of here at our clinic. Another thing that we really spend a lot of time with in our clinic is migraine and headache pain. I receive a lot of medical doctor referrals for headache pain, and headaches are unique to each individual, and they're not something that you can say one person is exactly like the next person. Each person is their own individual. They have their own reasons for having headache pain, and we really go the extra mile to try and figure out what your actual headache problem is and what it is triggered by. We found in the last few years of research that headache pain, about 80% of the time, is triggered by musculoskeletal pain. So tension, stress, and also biomechanical shifts in your cervical spine, especially the top three vertebrae, C1, C2, and C3, really will trigger headache pain on a regular basis in some individuals. Another thing that affects that is whiplash injuries and a loss of cervical curve or a reversal of cervical curve. And when you have those types of problems, they're very unique, they're difficult, and they can be a challenge, but it is something that is changeable and helpable through chiropractic manipulation if it's done properly with the right technique and in changing the biomechanical structures along with the curvature itself. We treat a lot of scoliosis problems. We discussed that, but I will say that most of the time scoliosis problems are attributed to a leg length imbalance. One leg has actually grown at a different rate, so it has an actually physically different length from left to right. So if you think about that, you can have a home, and if the foundation shifts or changes, the walls and the roof of the house will change as well. And so with scoliosis, by changing or balancing the foundation of the spine, you can straighten then the walls and the roof of the house, or the spine and the cervical spine. We treat extremity pain, lots of wrist pain, elbow, knee, hip, low back, ankle. All of those can have biomechanical changes, and chiropractic care is very effective in treating all of those things.